We are not insurance company. We just provide second medical opinion, which one is the best or which one is appropriate plan of treatment for them. We not deal directly about the cost or the money or the budget.
A lot of people don't know that we are good in medical and also dental treatment in Thailand. Thai dentists not just renowned for gentle treatment, also with the higher standard of treatment also. We kind of blend every technique from around the world to teach Thai dentists. So that's why we have the advantage. Somebody they don't know that we have to grind a little bit of their teeth out. If you do this, it will be pros and cons. So we have to tell them everything before they finally decide if they're going to do it or not.
Would you say Thailand has some of kind of the best dental options or treatments like in Southeast Asia?
With reasonable price, I think so.
Okay.
Welcome to our latest podcast on Thailand's future as a global medical health hub. Today, we're thrilled to have Lieutenant Colonel Dr. Chockchai Suwanakijboriharn and Assistant Professor Dr. Pakawat Chatriyanuyoke with us to discuss Allied Health Thailand's pioneering role in medical tourism. From dental care innovation to the unique strengths that make Thailand a sought-after destination for healthcare, this episode dives deep into the opportunities and challenges in the industry. Are you in need for a medical procedure? What hospital or doctor is best for your needs? Tune in to discover why Allied Health Thailand can help you with all those questions as it is redefining the standard of healthcare for international patients in Thailand.
Can you tell me a little bit about your journey in the medical field? How did you end up in medicine?
Okay, I'm a dentist, so I'm in the dental field. So my parents are dentists. I'm the seventh in my family who are dentists.
Oh, wow. Okay.
Yes, and so I did my dental school in Chulalongkorn University. And then I did my specialty at USA in prosthodontics and implant dentistry for about 5 years. And I was a faculty there at Loma Linda University and part-time there. And then I came back to Thailand and I work at dental hospital and Bamrungrad Hospital.
Okay.
And now I opened my own dental hospital called Global Dental Complex about in 2020, just right before COVID until now.
Okay. What led you to join Allied Health?
I and Dr. Chockchai, we are friends at about one of the course and about 2 years ago. And I heard that he has Allied Health as a agency to bring in international patient to Thailand.
Yeah.
So he knows that I'm expert in dental field. So he like me to join him in his team. So to build up the credential and more patient to come to Thailand, both medical and dental.
Okay. So, talking about medicine, obviously in Thailand for the last maybe 5 to 10 years, medical tourism is quite booming. Do you feel that a lot of people come to Thailand, they come for many reasons. They come for surgery, this and that, but do a lot of people come for dental purposes?
Yes. We are very famous for dental treatment because overseas the cost for dental treatment is quite expensive, and some they couldn't get the treatment because of the waiting list is so long. So in Thailand, we offer quick, affordable for dental treatment, and we have a reputation in good quality and highly experienced dentists. So when the patient came and have a treatment with us, they have a very satisfaction back, and they tell other to come here also for dental treatment. That's why we are booming also in dental tourism, not just medical tourism.
Okay. Would you say Thailand has some of kind of the best dental options or treatments like in Southeast Asia?
With reasonable price, I think so.
Okay.
Yeah.
All right.
I think so.
Talking about Thailand being a kind of like a global medical destination, like how do you see the future growth in medical tourism or opportunities in the future?
For Thailand,
Yeah.
yeah, I think we have a lot of opportunity with the I would say a lot of people still don't know that we are good in medical and also dental treatment in Thailand. So if we can tell or show them that we have a good facility, good doctor, good dentist, and they come here not just have a treatment, they can have a vacation and other things to be done in Thailand also. I think there's a big opportunity for Thailand to be leading in healthcare and wellness tourism. That's what I would think.
Okay. Can you tell me, like, for example, specifically for dental, like, is there a certain demographic that comes from medical tourism for dentistry? Like, are they normally young? Are they maybe some more mature crowd, more males, more females? Like, what kind of people are coming?
Normally, it's about middle-aged
Okay.
people because with younger patients, they don't have much problem. But these patients, they seek the treatment overseas because they have a lot of rotten teeth. And if they're going to do it in their country, especially in the Western country, it's going to cost them a lot of money. So that's why they come to Thailand because they know they have to have like an overall treatment for the whole mouth. Will cost a lot of money. So they came here with like affordable price with a good quality dentist and good facility. That's why these people, I would say middle-aged to older people.
Okay. And how do you think dentistry in Thailand, it might be different to other countries, or is there no difference? Like, is Thailand as good as maybe, in Europe or America?
A lot of Thai dentists graduated from very renowned university overseas, USA or Europe. And these dentists, they come back and they are faculty in the university in Thailand, most of the university in Thailand. So I would say that we know not only the US dentistry, we know European dentistry, we know Japanese dentistry. So we kind of blend every, how should I say, techniques from around the world to teach Thai dentists. So that's why we have the advantage that we know that US has this is good, but this is not good, but European has this good also.
Yeah.
So we kind of mix and match and teach our students. That's why Thai dentists not just renowned for gentle treatment, also with the higher standard of treatment also.
Okay. And do you feel like, how do the younger generation or the growing generation in Thailand, do you feel like people are looking more towards becoming dentists?
I think so. However, dentistry is quite unique. How should I say? Field, because you need to have a hand skill to work in the patient's mouth, which is very small. So you need a lot of practice, a lot of skill. And nowadays, I would say young
Younger
kids,
generation.
younger kids, they don't use a lot of hand skill because of the technology and those kind of things. So it may take them longer to do it as good as the standard is. However, if they keep practicing, I think there's no problem.
Okay. All right. Okay. Are there any recent legislative changes or government support that has significantly impacted the medical tourism industry in Thailand? Like, have there been any new changes that you like? Anything in particular that you think is great?
I can answer on a dental field.
Okay.
They have a plan or policy to to do a dental hub for Thailand from the Ministry of Public Health. However, it's kind of slowed down a little bit, couple years,
Yeah.
and I try to push them to bring it back to the table.
Yeah.
So we can going forward on a dental hub policy and plan because government know that dentistry or dental treatment can bring in a lot of money to Thailand, but I don't know why it slowed down a little bit lately. Yeah.
Dr. Chockchai, can you elaborate more on why using Allied Health is better than maybe contacting a hospital directly?
Okay, first, normally Thailand is medical tourism and medical hub center. So every company, every hospital also claim that is the best one. So the information like this go to the customer or the patient. So what is the best for him, for all them? Because of Allied Health will try to provide information about medical standard or standard of the physician, hospital standard, service facility of each healthcare provider or the hospital, and the cost. That means we provide more information about which one that right
For the customer.
to the customer.
Okay, so they basically...
So they can choose by themselves
Okay.
which one is the proper for them.
Okay.
Like Dr. Note, he is the best one of the dentists in Thailand. So we decided this hospital is have Dr. Note to be the best one first. The hospital service or standard and the cost we are ranking. So after advice from us, that's mean more than 20 or 40 years experience in healthcare service, we can sure that the information that provide for the customer may be benefit for them.
Okay.
More reliable.
More like yeah, sure.
More reliable.
Okay. So many people actually mistake Allied Health as an insurance company. So can you clarify, like, how exactly is Allied Health different from insurance providers?
First, we are not insurance company. We just provide first, second medical opinion or planning of the treatment for the customer. Which one is the best or which one is appropriate plan of the treatment for them.
Yeah.
And after that, we provide the information that more reliable that the nurse said. So they can choose by themselves. We not deal directly about the cost or the money or the budget that they need to pay.
Okay.
We just provide the
Providing a
information
service.
for the customer. That's all.
Okay. All right. So I was talking earlier about some of the challenges that Thailand is facing in the growing medical industry.
Right.
Can you tell me a little bit about how Allied Health is overcoming some of the challenges? Like, what challenges you feel that there are still currently, and how are you overcoming?
Normally, the medical tourism company, we try to make the customer more information, especially in first, second medical opinion, planning of the treatment or investigation. Secondly, provide a standard of the physician or the doctor that need to treat.
Yeah.
Because of when you walk in the hospital, you don't know which one of the doctor can treat you. So before that, before you judge or decide which hospital that you need to know which hospital, which doctor can help you.
So pretty much Allied Health screen
Yes.
this patient and the doctor
Yeah.
and match
Okay.
the disease and the patient and the doctor.
I see. I think this is fairly like quite a foreign concept maybe for Thai locals. Like, would you say a lot of your customers are mostly expats and foreigners?
When we start the operation like that, mostly is a foreigner, but recently half of the customer are Thai.
Okay. So there's like a change now.
Are Thai customer.
Yeah. Because normally, for example, it just in personal experience, like, from the people that even I know, you go to the doctor tells you what's wrong and it's fine. Like normally second opinions and screening is not, it's not a common practice in Thailand. So what do you think is changing that? Or is it more education? Is it like, maybe the newer generation or maybe middle-aged people these days are more informed?
Because of when you decided to go to the hospital, most of the customer recently may find the information about the suffering that they have
Okay.
before to go to the hospital.
Yeah.
But if you search in the internet,
Yeah.
such as Google or something like that, you may find that every symptom should be like that.
Okay.
So this is art of the doctor. So by using the information as much as possible, that means if you have the information you provide us, we can provide the information more accurately. So that's the challenging of this pattern of the healthcare service. Maybe not go directly to the hospital at all. You just need the second opinion, reliable or the standard opinion to decide it. Which doctor, which hospital that's met your request require.
I think mostly when patients choose hospital, they just choose the brand of the hospital.
Yeah.
But they don't know which doctor is good at what they need.
Right.
If that doctor is in that hospital or not. So that's how Allied Health come into play. So they've tried to find a good doctor that match the disease for this patient. Maybe not this hospital. It might be another hospital.
Okay.
Right.
All right.
Because of every hospital have the same service,
Yeah.
but
They might have the same.
they may difference
specialist.
in the specialist.
Okay. My question is now about maybe a little bit about dental. Can you tell me what type of dental services does Allied Health focus on, and how do they cater specifically to maybe what is in demand from international customers?
I will tell you solely like this. We have a customer from the Australia send the information to us and need to have some dental treatment. The processes or implantation, something like that.
Yeah.
So I'm not a dentist, but I trust him to provide the information. That's mean here we can treat in a short period of time. You need to have meet the specialist in a short period of time. In Australia, before you can meet the doctor, the specialist, the dentist, you need to wait a long period of time. That is the reason why you need to come here. First, it's more short queue. Secondly, the cost of the treatment, especially in the dentist, have lower than Australia. So you can plus the treatment, the dentist procedure,
And vacation.
and vacation in the same times,
Yeah.
Okay.
in the same budget.
Yeah.
And you still have money left compare if you treat it in
Right.
Australia.
Okay. Yeah. Fair enough. Doctor, can you share with me like some of the most popular procedures for dental specifically? Like what specific procedure do they come for?
Normally, if they come as a patient, normally it's a dental implant,
Okay.
veneers, and smile makeover, like total mouth reconstruction.
Yeah.
Those kind of things that come as a patient because these service cost a lot of money. However, if they come as a tourist, then they come for a checkup, maybe just teeth whitening or fillings. Easy stuff as a tourist.
Yeah.
They just come by, okay, I just do some dental work. Yeah.
Okay. Do you feel like the demand for these dental services has increased over the years?
It increased the global dental market last year is 35 billion US dollars. This year is projected to be 38 billion US dollars. And it's about 11% increase each year.
Each year.
So the demand increasing every year from the gum disease, tooth decay. And nowadays it's more aesthetic demand. The patient want their teeth to look more beautiful. They want to do veneer, they want to do a smile makeover. And these kind of things make the global market increasing. every year.
Do you sometimes feel like it might be unnecessary if someone wants to do a bit too much? Or are you just kind of helping them provide the right information?
For aesthetic is subjective.
Yeah, fair
So
enough.
each person is different. Some they just want their teeth to be beautiful.
Perfect,
We
yeah.
cannot say no to them, but we will advise them. Okay, if you do this, it will be pros and cons before they decide to do it. Just give them the correct information. Like veneer, somebody they don't know that we have to grind a little bit of that teeth out and put the ceramic veneer on top. Okay, they just know that okay, it looks nice, but they don't know the consequence afterward. So we have to tell them everything before they finally decide if they're gonna do it or not.
Okay.
The most important part is the standard information provide before judge which procedure is the best for him, suitable for him.
All right. It's talking about like procedures and stuff. Like, are there new technologies or trends in dental care that you're excited about at Allied Health?
Nowadays we normally with dental implant, I was go with dental implant first. We have to wait a couple months before we can put the crown or prosthesis. So you have to be without teeth for certain period of time.
Yeah.
Especially in the front teeth, you don't want to be without teeth, right? So what we can do is we can give the patient the crown the same day that we put the implant. So they go out the door with the teeth in their mouth. With a single tooth or full mouth, we can do that
And that's
within
not,
a day.
That's not common probably from where they're from. And
Right. And also, some may need a crown, like a fractured tooth.
Yeah.
They come in. Normally, you have to wait about a week to get the final restoration. We have what we call a smearing machine called CEREC. We can do it, the crown, within a couple hours. So if the patient came in with the fractured tooth, we just put the crown in within 2-3 hours. That's it. They don't have to come back.
All right. You know, during all these processes, there's a lot of process. Like, firstly, people find out about it, then they research about it. Can I just ask, how does Allied Health, for example, ensure that these patients coming in get the top quality service? So can you give me an example of like from consultation to actually making it happen to follow up? How does it work?
Normally, if you decided to choose Allied Health, that means you need to have some information that you have first. For the dentist, maybe need some picture.
Yeah, picture or
the
X-ray.
mouth, the X-ray of the picture. And after that, we will send to the specialist first to have the opinion for the treatment, the situation. This is the initial situation because of this is initial information from the customer.
Yeah.
And after that, we will select which hospital or healthcare provider or the clinic that is suitable for that customer. Secondly, this is the initial estimate planning of the treatment, including the cost. But finally, this depends on they need to meet the doctor for the accurate planning of the treatment. That's all. This is the reason why we can provide the information before you came here. That means the most important part is medical information from the customer.
Yeah.
And the time saving, because
Right.
normally if you send to the hospital, you have to wait maybe a week or two before the doctor can get back because of the process of the hospital.
Yeah.
But with Allied Health, you send it to Allied Health, and then Allied Health send directly to the doctor. So it's just cut the process. So everything goes to the doctor, answer within a couple of days, and then that's it.
Okay.
Yes. The target or the KPI of us is not longer than 48 hours.
Yeah.
That's all.
Okay.
When I work for another healthcare chain, we have the KPI for what we call email correspondent team. Send after receive the information from the customer, we will send to the doctor. The problem is some department need to wait around 10 days.
Okay.
That is not good for the customer.
Yeah.
So we can shortcut the waiting time and the period of the planning of the treatment or investigation of the cost to decide it, which one is the best.
Okay. Talking about like, you know, all these services, and I want to talk a little bit about affordability. Like some people, they only look at the cost, but not everyone only looks at the cost. So what are the considerations? I think you've named, like, obviously the quality of the doctor, the quality of the hospital, and the quality of the money. But like, what would you say is different about Thailand?
As I told you before,
Yeah.
the cost of the treatment every single procedure is cheaper than another country in the world. Compare with the Australia or Singapore, we can compete with the standard, high standard of treatment. That means you can short period of time. That's all.
Looking ahead, like, what opportunities do you see for Thailand as it continues to grow the global medical hub?
This is the reason why I set up the company, because of we need to have my first target is a more sustainable business. That means we can do the sustainable by using the ranking of the standard, medical standard, as I told you, hospital standard, service facility, and the cost, and then they can choose by themselves which one is suitable for them. We will rank 1, 2, 3, 4, and we advise which one we advise. That's all.
Okay. All right.
You can decide it by yourself which one is suitable for you. Some guy maybe focus on the cost only. Okay, for sure you need to focus on the cheapest,
Yeah.
but the quality may be not the same.
Okay. Doctor, if you wanted to maybe see either make a change or you want to see something change in the future, what would that one thing be? It could be just maybe from a dental point of view.
In Thailand or
In Thailand.
for it, you mean for the international patient or
Yeah,
for
like,
overall dental?
for international patients, like, what could be made better? What would help you or help the customers have a better experience?
Like I said before, I think I want the government to push more for the dental hub in Thailand, because we have a very good facility and dentists.
Yeah.
But around the world, some they know us, but some they don't know that we can do this
Yeah.
within a short period of time and save costs. And also you can come to Thailand and experience Thai hospitality. We have a very good staff. Lots of patients, when they come to Thailand, what they like the most is the service hospitality, Thai smile.
Yes.
So they cannot find it somewhere else.
Yeah.
Even doctor and staff, everyone have a good hospitality.
Last few questions before we close up here. For those considering Medicare in Thailand, what advice would you give international patients who are new to the idea of medical tourism?
Okay,
Any advice you would give to international patients who are new to the idea of medical tourism? Because people know tourism in general, but they have no idea that you can come to a country just for medical.
Actually, you may surprisingly more than 2 million foreigners came to Thailand for the medical treatment.
Okay.
Not only the medical, but dentists too. One of the top procedure that they come is dentist, medical checkup, aesthetic. That's mean
Facial aesthetic.
A surgery and stuff. Okay, I got it. Okay.
including all the body too.
Okay.
Such as in the southern part,
Yeah.
we have the hub, try to make it over beautiful. Upper surgery, lower surgery. What kind of surgery for the aesthetic is okay. Back to the dentist. We try to make it more sustained. We trust that any healthcare in Thailand is more standard than before. First. Secondly, some guy know about that higher standard, but some guy know.
Yeah.
So we try to set up this company, provide more information about every single disease or the condition they need to have
Yeah.
to treatment. So that means we have website to provide the information for the dentist, for the heart, for the aesthetic, or every single procedure to make them know which one is okay.
Okay. All right.
Nobody else has done it before.
Yes, yes.
Yeah.
And we sometimes they don't need to repeat operation for treatment, right?
Yeah.
So we try to avoid that
Okay.
by select the best one, the better one, including the physician, the hospital,
Okay.
the service facility, and the cost maybe come later, in my opinion.
Okay. Can you share any exciting projects or services Allied Health is working on that we should be looking forward to?
As I told you, most of the disease right now is first the cancer, the heart. That's improved a lot. The dentist, so we can provide some issue like that for the customer to more information to have more information as much as possible.
Yeah.
Including the opinion of the treatment of everything like that. Not easy,
Yeah.
but I'm rather sure that it's possible to do.
Okay. All right. Doctor, anything you'd like to share about dentistry or your any final thoughts?
For us, when the patient come in, we do a 3D dental checkup. We scan the teeth, okay, and show them in the big picture, and show them what is wrong with their teeth. Normally, you have to look with the mirror and try to see inside, which is very small. Now we put it in the big
camera,
big picture, and then you just it's a 3D dimensional. We just swipe and show them this is wrong, this is wrong, this is what you should do, and patient can see better, and they know that okay, they have problem.
Yeah.
Yeah.
Okay.
So you can provide compare with before and after
Yes, that
treatment
also.
too.
Okay.
That's before and after. Yes.
So just it's also kind of helping the patient understand
Much better.
exactly what's happened, what was it like before, what have you improved. So then I think there's also like not just this hospitality and service during, but giving them almost an education to kind of understand what has just happened.
Right.
By using the high edge technology that we have.
Yep.
All right. Doctor, any final thoughts, anything you'd like to share?
Allied Health try to provide the second medical opinion, planning the right investigation and right treatment by right physician, appropriate hospital, appropriate cost and the service. So we can provide that. We can good staff, we can have more relationship or have many contracts to the better healthcare provider, including the clinic for the any kind of the procedure. Our company focus on two parts: medical tourism agency, something like that, and the wellness. Right now we talk about the medical tourist depart in that part, including in general disease and the dentist. So all of the scope that Thailand can provide the treatment, we can provide you information or investigation for the information that you provide to us. That's all.
Okay.
Within 48 hours.
Yeah. Just I think you can trust Thai doctor and dentist. We can treat pretty much any problem. Yeah. You don't have to fly to US or Europe just to do like difficult stuff. We can do everything here.
Okay. All right. Is it expensive to use Allied Health?
For the customer,
Yeah.
the customer don't need to pay for us at all.
Okay.
We just provide the information, that's all.
Oh, that's about it. Thank you, doctors,
you.
for taking the time for coming
Okay.
and having this talk with me. And we look forward to more and more exciting things from Allied Health and hopefully also the medical industry in Thailand.
Okay.
Thank you.
so much.
Thank you very much.